Once again, I'd like to welcome you to our session today that's part of the Faculty Leading the Change series. This session is going to cover teaching social determinants of health, what students are saying. Today we have Dr. Angela Prehn on the line. She is the Associate Dean in the PhD in Public Health program that is part of the College of Health Sciences and Public Policy. It's so great to have you, Dr. Prehn, and I am going to turn things over to you. Welcome.
Thank you so much, Lita. I'm so happy to be able to present today. I'm going to be working through and talking about a project that we did in our PhD in Public Health program. And by we, I really mean Dr. Amy Ferraro, who was the lead on this project before she left Walden and really did a lot of the analysis and the data collection that you're going to see presented here this afternoon. So Lita, next slide, please. So what I'm hoping is that after we're done with this session, you will have a better idea of how our program incorporated social determinants of health into our curriculum, and then also what impact that had on students in terms of their thoughts about being taught social determinants of health, but also a little bit of quantitative data on what social determinants of health is looking like in their dissertation process once they get to that point. So those are really the goals for this session, and let's get started. Next slide, please. I wanted to give you a little bit of background first about what this project even was and why it happened. We just had a kind of very serendipitous timing in the PhD in Public Health program. Right around 2020 and 2021, we were revising our entire curriculum, really updating it and adding a lot of new content. And as you know, right around that same time frame, Walden also decided to focus on social determinants of health as a university framework. And so part of what we did in redesigning our curriculum, our program of study, was to really incorporate a lot of social determinants of health elements into the coursework all the way through the program. I should say, though, that being in public health, our discipline has used social determinants of health as a framework for probably 20 years or so now. So our discipline is somewhat familiar already with the framework, which means that there was already some content in our curriculum. We just really enhanced and emphasized and really made it more explicit in the new curriculum. So we integrated things like different aspects of social determinants of health learning, which I'll talk about in just a minute. And we also really tried to make a lot of the assignments sort of applied in real life so that students could understand how to take this framework and really use it, not only in their dissertation research, but also in their careers moving forward. So this new curriculum was launched in the summer of 2021. So last year in 2023, and right about a year ago, actually, we decided, well, let's take a look at how we're doing in teaching this framework to our students. So we embarked upon this project to really sort of look at the first couple years worth of data in our program and get some sense of whether or not students were learning what we were hoping they were learning. Next slide, please. In order to do this, we did a number of things, and I'm going to talk about a couple of them here today. So one of the things we did was we held qualitative interviews with a sample of our PhD in public health students right about a year ago now. And we had 10 students respond to our recruitment efforts, and we guided them through a semi-structured interview and then did some qualitative analysis of their responses to the interview questions. We also did a kind of a review of our curriculum as a whole and just really looked at it once again to make sure we identified all the places we had incorporated social determinants of health and really understood how they were spread throughout the curriculum. We sort of wanted to verify what we had done a couple of years previously. We also did some assessment work and looked at some dissertations. So next slide, please. So for the dissertation review, we decided rather than trying to read every word of every dissertation, what we did is we looked at dissertations published between 2021 and the early part of 2023 And we looked at titles, abstracts, and keywords for terms that are social determinants of health or that indicated SDOH related content. And then we did just a few descriptive statistics to understand what that looked like. So we looked at the percentage of dissertations that had a focus on social determinants of health, the percentage that used a theory that related to social determinants of health, and then we also did a keyword frequency analysis to see how many times keywords associated with the social determinants would pop up. If you'll notice, we started the review of the dissertations in January of 2021, which is before our new curriculum rolled out, and certainly students who were in the dissertation at that time or who had completed dissertations at that time experienced our old curriculum, not the new one. And that's purposeful because we wanted to get a baseline of how much of the social determinants information was already being incorporated into dissertation by our students. Because remember, I said our discipline had already been using that framework for a couple of decades. And so we knew that students came into the program already with some knowledge of social determinants. And we already knew that some students were focused on that in dissertations. So we just needed to get a good baseline to start with, so then we could see what happened once we introduced the new curriculum. Next slide, please. So this slide really is an overview of our analysis of the framework that we incorporated throughout our curriculum. And so the way we did it, we decided that we were going to scaffold learning about social determinants of health throughout the curriculum. So we very purposefully started with the beginning courses in the curriculum incorporating really introductory elements around social determinants. Things like, on the left-hand side of the slide here, definitions and terminology. And then as students moved through the program, they took courses on ethics and theory and got into research courses. And so we incorporated learning around social determinants of health for those elements sort of in the midway through the curriculum. And then toward the end, we focused more and more on research methods, applications in real life, those sorts of things as students were completing their coursework and getting ready to move on to their dissertation. So this scaffolding approach allowed us to teach a number of different elements of the framework to students at different points in time, but also to connect them, right, to each other throughout the curriculum. And so we were hoping that we were really building students' skills and knowledge as they went through the coursework before they hit the dissertation. Next slide, please. So I thought for faculty, it would be really interesting for you guys to see, how did we do this? What are some examples of what do we mean when we say we built social determinants of health into our courses? So I have a couple of examples from the early, mid, and late parts of our curriculum, just to give you an idea of some of the things we did. So early on in the curriculum, for example, we have a global health class. And in one example of how we incorporated social determinants there was we had a discussion around vulnerable populations. And so we defined what that meant. So this is all about definitions. So we defined vulnerable populations. We provided resources around social determinants of health. And then we asked the students to discuss a population and social determinants as they relate to a particular health issue in that population. So that was one way we incorporated, just getting students to understand, what does social determinants of health even really mean? Next slide, please. More toward the middle of our curriculum, we have a public health ethics course. And so toward the end of that course, we decided to incorporate social determinants in a really sort of meaty discussion. This was the last discussion in the course around race, racism, ethics, and infant mortality. So in this discussion, we really challenged students to talk about the social determinants of Black infant mortality, including racism, as a social determinant of health, and really understand the ethical issues involved in thinking about that complex topic. And one of our purposes here, and kind of especially in the mid and later parts of the curriculum, was to really emphasize to students that social determinants of health is very complex, right? We have all sorts of factors coming from all sorts of different places influencing health. And so we really wanted students to understand that this framework is a complex framework. And so trying to give them some tools to think through the issues that arise when you're trying to work with a complex framework like social determinants. So this is an example from the mid-curriculum. Next slide, please. And this is an example from toward the end when students are doing some of their specialization courses, because we have 3 specializations in our program. And in this case, we have an epidemiology specialization. So students focused on social epidemiology, which really is all about studying social determinants of health in epidemiology. And so we asked them to use the framework to analyze a problem and then evaluate how they'd actually measure upstream factors or those social determinants of factors that contribute to the health problem. So we really tried to connect this to possible research they might do, or even if they're out working on public health problems and trying to develop programs and such out in the community. How do you even measure these factors that you want to be able to evaluate and then incorporate perhaps in interventions out in the community or in a research study? So that is those are just some brief examples of how we taught social determinants of health in our curriculum. Next slide, please. So after the curriculum is over, right, then students go on to their dissertation. And so these are the data that we sort of are presenting, that where we looked at, okay, how many of our students are actually doing dissertations that pertain to social determinants of health? So the graph on the left is the percent of completed dissertations by year that focused on social determinants of health. And so what you can see is if you look at the data for 2021, we already had 48% of our students that had a dissertation related to social determinants of health. So remember I said we wanted to see our baseline. Well, what we found was our baseline was pretty high to start with. We already had students in our old curriculum who wanted to do social determinants. And that percentage went up a little bit in 2022 and 2023. It will be, and that, remember, these data from 2023 are only from the first 3 months of the year. So we don't have full data for that particular year. We're very curious to see what's going to happen now when we go back and look at the rest of 2023 and into 2024 data to see if that percentage continues to increase. When we look at theory on the right-hand side, so, we also saw something very interesting, which was that our baseline was that, 30% of our students were already using a theory that we associated with social determinants of health, like a biopsychosocial theory or an ecosocial theory. Those kinds of theories that really kind of address the hierarchical, multi-layer complexity of social determinants. And then we had in the first 3 months of 2023 a huge bump where 48% of those completed dissertations actually involved a theory. And so what we don't know yet, because again, that was a smaller sample size, is how big of a bump that will turn out to be once we actually look at the whole year. But it was kind of interesting for us to see this big increase in the first 3 months of the year. And maybe that indicates that some of the curriculum that we've been teaching as of late has really helped students to connect theory to their research work and their dissertations. Next slide, please. So I wanted to present next, really what are students saying, right? Because what are they really thinking and feeling and saying about social determinants of health as they learned it in their coursework and as they're using it in their dissertations? So what I'm going to present in the next couple of slides are the results of the qualitative analysis that we did from the structured interviews or semi-structured interviews. So the first thing to know is that we did find out that the majority of the students we interviewed did have prior knowledge of and exposure to social determinants through either their master's training or their work experience or both. This wasn't really a surprise to us, given the longevity of this framework in our discipline, but it's more of a confirmation of what we thought we already knew. However, no student was familiar with Walden's integration of the framework at the university level. So that was just something that if it had been communicated to them, they hadn't heard it or read it. They didn't even really realize that this was a larger university focus now. We also got really great feedback from the students that they felt that even though they came in with some knowledge of social determinants, what they learned throughout the coursework through that scaffolded process really enriched their understanding of this framework and really helped them understand how they could apply it in many ways. So that was good news. And when they talked about it, they really talked about its link with social change, which again is something that is just sort of, I think, inherent in that conversation. When you're talking about social determinants of health, you talk about social change. And certainly at Walden, that's a link that we've been making more explicit all the time. So that was good to see that viewpoint certainly was coming through. And I included one quote here from a student who that I think just sort of exemplified what the students said about identifying social determinants of health learning throughout their coursework, which was that they saw it. They understood that it was a connector through the courses, and that it really made sense to them that they were continuing to learn about it as they went through the coursework. So next slide, please. So then we asked, because we were curious, we asked them to define social determinants of health. What was their definition? And I realized I forgot to say something important about this group of students. I mean, it was a small sample size, but one thing we did try to do was to get students at all points in the curriculum. So we interviewed students who were early on in the program, mid-program, and late program. So again, it's not a huge sample size. There were only 10 total. So there's only three students sort of from each phase of the coursework, but they do represent the range of sort of experience in our coursework. So regardless of where they were, however, in the coursework, these are the quotes that some of the students came up with around their definitions of social determinants. And it's really interesting to see how they interpreted what they learned, right? So, one person on the left here said that factors that are outside an individual's control was really sort of their definition. Factors that influence, overall individual's health. Factors that influence whether or not humans get their basic needs met, which I thought was a very interesting definition. Things that bring about inequity or inequality. So a really wide range of definitions, but definitely all underneath the umbrella definition of what social determinants of health are and what they do. Next slide, please. We also really wanted to get a sense of, well, okay, we've been teaching you about social determinants of health. What are you going to do with this information? Or are you going to do anything with this information? So we asked are you going to do anything with this information first? And every student we interviewed reported seeing themselves either engaged in research or practice using social determinants of health in their future. So that was fantastic. And we hadn't expected 100% response in that, but it was fantastic to see. And then when we asked them a little bit more about, okay, so what does that look like for you? These are really sort of what the students talked about in terms of their future involvement in social determinants. They talked about using the determinants to understand the root cause of disparities for different diseases, to personalize interventions and services to help individuals and communities, to address barriers related to social determinants of health, right? So lack of awareness of service and access for disadvantaged populations, to influence policy change to address social determinants through evidence-based research, and to understand the broader impact of interventions, to inform health economics and real-world evidence research. So again, a very broad understanding and application of social determinants of health, which in our sort of analysis of all of this made us think that the scaffolding approach that we took to teaching social determinants really helped students to be able to understand sort of their broad application. So we're seeing connections between what we taught in the curriculum and how students are taking that and thinking about its use in their dissertations and in their future as public health professionals. So next slide, please. So really, the conclusions that we came to was that our scaffolded approach to teaching social determinants is working. Students were exposed to many different ways of learning about social determinants, many different aspects of it, and they felt they gained a robust understanding of the framework. They also felt that the curriculum was not redundant for them, even though some of them came in with knowledge about social determinants. They felt that what they learned really enhanced the knowledge they already had. And for students who weren't as familiar, they were able to build that knowledge as they went along. They also really recognized that they were learning this along the way and that they could see the application of the framework in their future. The other piece of it is that we learned that our students are contributing to the literature on social determinants through their dissertation research. At least half of the students appear to be doing and completing dissertations around social determinants, and that may increase. That is something we're continuing to investigate. But they really are advancing knowledge and insights using this framework, which is fantastic. And that's really about it. That's what I had to present today. I'm happy to take any questions you might have.
And please feel free to come off of mute. Everyone's mic is enabled. Thank you. Great information, by the way, Dr. Prehn.
Oh, thank you.
A lot of work that went into it.
Amy did a fantastic job.
I'm not seeing any questions come in. I think you discussed it in great detail. Give everyone just a second longer if you have any questions or comments.
And I'm always happy to follow up with anyone afterwards by email too. If you needed to think about something a little bit or a question pops up later, happy to talk about it.
Fantastic. Well, thank you so much for carving out time to present this again today. It was very informative, and thanks to our participants for hopping on and spending time with us, soaking in this great information. If you have any questions about the content for today's session, please reach out to Dr. Prehn. If you have any questions related to upcoming professional development opportunities or any past ones, please don't hesitate to reach out to us in OTLE. Today's recording is going to be placed into Commons and also on our OTLE site for future viewing. Thank you once again, Dr. Prehn. Always a pleasure.
Thank you, Lita. Have a good afternoon, everyone.
You too.